exposure.
In any surgery, emergency surgery which you are performing, you have to operate the patient. You have to keep one thing in mind, that you need to make a quick access to the desired organ.
No, his question is also very. We will answer this
Because
question.
if we will go with clamshell, na, so it will take some
No,
time.
no, it's okay. It's okay.
Let's have
This
a
time-
note.
this time
we
we
will
are
have
doing-
debriefing later on, and let's not have cross talk. Okay, so
Okay.
we are doing
This
left
time-
anterior lateral.
This time
report.
we are doing procedure. Focus on that. Whatever the question
So who is
related
the
to
assistant for
this
him? Who
or
will apply
except
the-
that, you can ask.
Venusator retractor. कोई है experience? You can apply this. So we'll
Okay.
tell you.
I will go in fourth intercostal space. The rough identification of that space is below that space. Right?
Other side of the nipple.
Yeah. You don't go and count all. No issue. If that is fifth intercostal space, you go by default. No issue. Fine. Usually go under the nipple line.
In both male and female, both.
Yeah, in female you have to lift up breast and go at the
Inframammary.
base of inframammary. Fine.
So from where you will start your incision?
I will start my incision from that mid-axillary line to sternum, anterior, just left lateral to sternum.
No, I will differ from you. We will start incision. That's what. So that if we need to convert in clamshell, we can. So we will start always from the right side. We will always start, even for left anterolateral also. So in case if we have to turn into clamshell, so we can do. So incision even for left anterolateral will start from the right side of the chest, right nipple.
Practice difference. This.
नहीं, but this is internationally recommendations. यहाँ से होगा क्योंकि हमें clamshell करना तो फिर immediately हम
We
कर
can
सके.
extend that.
नहीं, नहीं,
Jana,
skin.
I am coming to this part. We can extend this continue. That.
No. What I am saying, like, let's start incision, skin incision. I am saying with the right side of the chest, and we will go deeper on the left side. Just skin incision, so that we have marker. But
Fine.
okay, that's
Okay,
what we
so,
have learned. But I'm not
usual-
an expert. I'm not a trauma surgeon.
No, it's
He's
okay.
a trauma
sir.
surgeon.
No issue
Chalo,
with
okay.
that incision. You just go like sir told, or you can go from here, whatever your. Sometimes it depends on
Institutional
approach.
protocol?
You sometimes you can extend that side also. Same surgeon can do with this incision. Other
Yeah,
surgeon
वो
require
बिना-
more
AC is not
approach. No issue.
No,
Okay.
Coffee will have. Anybody can have coffee anytime. Biscuits, coffee, है ना? ऐसा नहीं है. Okay, and full stomach, empty bladder. That is the reason I told.
Okay.
So start. We are starting.
In that,
Yeah.
I will go with 2 or 3 steps. I will reach till that space. Okay, with 2 or 3
Swipe or incisions. Go up to axilla. Up to axilla. We assume that hand is like this. Okay. So you have to take 2-3 swipe. 2-3 बार incise करना है. Then only you will go. And he will need
only
nail
thing
scissor.
here
There.
you have to worry about what is that?
No. As of now, we will not worry about anything. Go ahead. If we start worrying, then we will never be able to perform. So in this procedure, we will never worry about even phrenic nerve and this and that. Okay? We'll give the incision. अभी का हो जाएगा ना? Okay.
This is
Little bit faster, Dinesh. But be careful.
yeah.
Oh,
This is
slow
more
then.
tougher.
See, the incision has to be slightly deeper. Then you use myocision. You have to cut more with this blade. Yes. हाँ yes. वो इसमें तो जाना ही पड़ेगा.
इसमें ये ध्यान रखना है, you have to go on upper side of lower region.
That we, I think, learned during ICD.
This is external part. You can lift it. Let it move. Okay. This time you have to apply phenycytol. Try to put it on this side.
Oh, I do other way. I put this in axilla.
Sometimes you may need extension also. We can put
ऐसे. I put this way. ये फिर साइड में आ जाता है ना?
दोनों को
you will have to use fingers ना, spread करो इनको.
okay, and your assistant will put it.
हाँ, now आप इनको दो.
Go at down side.
थोड़ा सा आगे ले आओ इसको, सिमुलेशन के लिए थोड़ा बेटर रहेगा. वहाँ इतना होल्ड नहीं होगा, आगे ले आओ. यस, नीचे करो. सो क्रैंक इट ओपन है ना. तो ये देखो फिनिशिटर रिट्रैक्टर है और कैसे इसको अप्लाई करते हैं. सो आवर आइडिया इज जस्ट टू शो, आपको ये वाला रिट्रैक्टर दिखाना है. What do you see? Now everybody will have a look. Okay. Niki, it's okay. This is simulation. Come to that side. So now,
you can watch over there. You can
अभी
see
रुको
over
रुको.
there.
Yes. What do you see, Dr. Dinesh?
Yeah.
What will you do? So left lung will interfere. Okay. So left lung will interfere in your visualization of the heart. So Dr. Bhagat, you will do right bronchus intubation, so that left lung doesn't come again and again, because that I felt. Okay, so what you see here, is there any bleeding? You can see.
Yeah. There is function is so far.
ये देखते रहो आप, पूरा आपको हार्ट देखना ना, पोस्टीरियरली भी देखना है. You will see. Light please.
First of all, if any collection is there, कुछ
कहाँ है? Yeah. See. So that's what happened in real scenario also. So where is the bleed? Expose करो हार्ट को. ये this is the. Where is was the wound? So this is the reason why he is having tamponade. Can you see the bleed? आप इधर आओ फिर. ये नीचे है, पोस्टीरियर में हमने बनाया है ताकि you have to expose the heart. अच्छा, it is there. हाँ, वहाँ पे देखो.
Expose it by hand so that they can see.
On the screen. चलो वहाँ देखो फिर.
You can see.
Yes. So what will you do now, Dr. Dinesh?
First of all, I will go for that pericardium.
You will dissect the pericardium. So dissect the pericardium. And you will use tooth forceps. Pericardium है इसमें? ऊपर की लेयर है? चलो we'll simulate. So we have dissected the pericardium. Okay.
Go away. Right. You release pericardium as much as you.
Even if there is no blood, release the pericardium. What next?
Next, I will put my finger at the.
So this is very important step. On the
put finger. First, you have to release heart from the pericardium. Extract the heart from pericardium and look for the injury site. I am seeing here that.
So ideally, after pericardium, we should have.
I
made the
expose
heart to
pericardium
beat.
and there is. This is.
Now yes.
I will put my finger and.
Show us reading over there in the screen.
So you put your finger. Yes. So yes.
Right. So only best thing is just put your finger at this point, right?
And then finger कब तक रखेंगे?
Finger, I will go for repair it till the
बस
thing
इसको-
which whatever I require available.
So how will you repair it?
With mattress suture.
Which suture? ये तो आपका एग्जाम में आने वाला है.
नहीं, PDS usually we use PDS number 2 suture. 2
Again, I am not a trauma surgeon, but it is 20 proline. Okay.
20.
So one of very highly acclaimed international surgeon is my friend Dennis Kim. है ना? So he is a master of high street procedure. So we will repair it with 20 proline, or we can staple also.
Staple
Okay.
also.
Or Foley sometime. Okay. Any cavity you can, but nowadays Foley usually used in right side.
For
Injury.
that is like you did this procedure in ED. Now you have to shift patient to OR. At that time you can put Foley. That is that. Or you can also use the satin skin. Okay. You how to use that satin skin? You just put like that.
I'm not aware this
Yeah,
skin being used for.
Yes.
Okay.
You can put like this.
So this is Stansky clamp, okay, and okay. So you have repaired your wound. Now, how much is the blood pressure, Akanksha? It is 100/70 now. Okay, his blood pressure has come up. Okay, improving, and sets intubation say already it was 95%. Now circulation has come. So now their vitals. If I repeat the vitals, his saturation is 96%.
Quite satisfactory.
100/70 his blood pressure. Okay, and there is now pupillary reaction. So what is your next plan?
Next plan, I will explore for other injuries also here.
Call everybody and let them repair it. Now your
No.
job is over. But as an emergency physician,
Okay.
our job is over because we cannot be a cardiothoracic surgeon. But he is. He's a trauma surgeon. So clap him. He has saved the patient.
So technique to repair the engine.
यार वो नहीं है अभी हमें तो
Always team
see,
approach
my
is
idea is to teach you and show you rather these are the instruments. This is the phenocenter detector. This is Stansky clamp. This is how the heart you can expose.
How many
Okay,
Foley's
but
हैं?
detail
How
में
to use Foley's?
नहीं वो Foley's नहीं अभी see we don't want to them to be master. So वो you can learn from your respective
सर है
CTVS.
वो अभी कर लेंगे अपन डिस्कशन कर लेंगे हाँ हाँ नो इशू
प्लीज सर का एक और हम क्वेश्चन पूछने वाले हैं ना अभी वी विल टेक द सिनेरियो टू सम अदर साइड ओके ओके सपोज you did this thoracotomy and you don't find anything else. There's nothing. What will you do?
there is nothing in heart or no active bleed from lungs also.
Yes.
Then I will search for the other cause of that hypotension that could be due to
No,
bone
the
and
patient is in arrest. What will you do?
internal cardiac massage.
No, no. What will you do before that? आपका तो एग्जाम ही हो रहा है बताओ आप.
Internal cardiac massage. Patient is in a state of arrest. There is no active bleed. Okay. Two options we usually do. One is there is wound, fast is positive, मतलब probably
No, no. What will you do here?
cross clamping of aorta.
Yes.
हॉल में होंगे हॉल
That is what he should do. We will clamp the aorta. Why we will clamp the aorta? If you don't mind, come here.
Abdominal right side.
एक मिनट.
Common. So
Why will we clamp? Why is clamping aorta?
To increase the blood supply of heart.
Heart से फिर कहाँ जाएगा? Ultimately, we have to save the master organ, brain. Okay. So, are your brain perfusing well against gravity? Brain perfusing well. So that's why we need to clamp the aorta. Okay. So how do you clamp aorta?
okay.
Because what lies with aorta? Esophagus. And now because whole blood is drained, so it will not be like juicy aorta.
Collapse.
It will be collapsed. So how will you identify that you are clamping the aorta only?
First, I will tell my assistant or whoever available. Please put a RT. That is the best method. So you
एनजी
can,
ट्यूब इंटरनेशनल इसको अब हम थोड़ा इंटरनेशनल लैंग्वेज में बात करेंगे एनजी ट्यूब है ना आरटी से कुछ नहीं समझ पाते सो वी आर ट्राइंग टू मॉडर्नाइज ट्रॉमा केयर इन इंडिया सो वी विल यूज इंटरनेशनल टर्म्स ओके सो वी विल यूज एनजी टर्म ओ सॉरी एनजी ट्यूब सो यू पुट द एनजी ट्यूब टेल हिम दैट आई हैव पुट द एनजी ट्यूब
yeah. I will cut that inferior pulmonary ligament and go across to the till the spine.
Is it necessary to cut the
Many times.
or before that what will you do?
Actually, if patient that ET tube in before the carina, there is
Coffee.
most probable chance that lung is expanded. So if you want to approach at this medially, so you have to mobilize the.
Before
lower
that,
lobe.
what will you do? You need to dissect something to access aorta,
Yeah, that's why I am remove.
mediastinum, pleura.
Yeah.
उसको भी तो dissect करना पड़ेगा ना?
Usually what we.
Nowadays, I am listening. Basically, वो कह रहे हैं कि there is no need to inferior pulmonary ligament. You dissect the mediastinum pleura and go to aorta, go towards aorta.
Yeah, practically that is. I also read that, but practically
Okay,
that is
we are not
very
going
difficult.
into details again. So we will then
then just mobilize the lung away from that medial side and go for just feel spine up. Then there is three structure is there. That esophagus, NG tube is there. You can feel by palpating between finger and thumb, and then spine. Between them there is actually something is covering the fascia is covering both. You just your finger and dissect between both of them.
Blunt dissection.
Right, blunt dissection by finger.
So it's a cross clamping or it's a just clamping of aorta? You are saying cross clamping or it is just clamping?
Basically, it's just clamp.
This is my own query.
No. We doing clamping, but the thing is that I think word we use is that is cross clamping.
Okay. Okay. It's not clear. Maybe I'll look. मैं ये सोच रहा हूँ कि क्रॉस में शायद कहीं दो तो नहीं लगते हैं.
नहीं वन ही लग रहा है.
Okay. And what are the other clamps you can use? This is Stansky.
This is Satansky, or you can use that
Other very great.
sponge holder.
No. Other great vascular surgeon. उसके नाम पे है ना वो clamp.
Debaki. हाँ वो.
Have you read his book?
Yeah, Debaki clamp.
नहीं आपने उसकी किताब पढ़ी है?
किताब नहीं, उसके चैप्टर.
नहीं उसकी वो पढ़ो बायोग्राफी. ऑटोबायोग्राफी है. टाइम So, like for 15 minutes before entering to the hospital, he arrested, and then you decide to do ED thoracotomy.
Right.
But nowadays it is not ED; it is resuscitative thoracotomy. So, what are those signs? He's also and the patient is unresponsive. So, what are the signs which will tell you that you should go for resuscitative thoracotomy? Tell us the sign of life. In resuscitative thoracotomy.
Patient has witnessed cardiac arrest. Right?
Is it
Patient
traumatic
is
cardiac? You have communicated with the
you have to check for everything, like gunshot patient critically ill may have shock index or modified shock index. What is shock index? That is heart rate upon systolic BP. That should be less than 0.7, 0.8. More than one is showing shock.
patient is having shock.
Right? And that is upper and corrected version is modified shock index.
So
That
we will just
calculates
now he becomes unresponsive. What will you do now? You understand this? You are understanding the scenario?
Yeah.
He was talking, but while talking he became diaphoretic and suddenly he became unresponsive. What will you do now?
Now patient is unresponsive, so think about again
Think
ABC.
do.
Okay, I will again check for the.
No, he's unresponsive.
And
You are going for this thoracotomy. Okay, tell us the.
ED thoracotomy set usually.
We will use the word RT because this is resuscitative thoracotomy. Patient has died. मतलब सब
This is,
लोग इसे
resuscitation basically.
ED नहीं हम
Resuscitate.
resuscitative thoracotomy. Okay, so we will just simulate. Yes. यहाँ एक तो I said ना psychological safety को हमें simulate करके देखना है. अगर हम नहीं करेंगे ना, we will never learn. If we assume things, हाँ मैं कर लूँगा, because I used to do those things. मैं कर लिया, मैं देख लूँगा. पर जब हम रियल में करते हैं, and there is a one concept, deliberate practices. We must do deliberate practice. अगर छोटा BVM भी करना ना, I'm telling you, most important skill in aerodynamics is BVM only. जब रियल में जब CPR होता है तो BVM का कुछ लोग कर रहे होते हैं, है ना तो सील बन पाती है. ओके, तो मास्क भी दे दो. तो maybe they have decapitated him. नहीं तो इसका हेड भी था. But नाइट में वो ऋषिकेश का क्या था प्रेग्नेंट लेडी डिकैपिटेशन ऑफ द फीटस, तो उसका शायद रीबर्थ हो गया है. कहाँ है उसका सर? So we will depend on them what they give us. So they are working really very hard, and for everybody I have designed this mannequin and we are manufacturing. Okay, so we will, as of now he is doing BVM. No, he is intubated. Okay, then what next?
Okay, I will in resuscitative thoracotomy.
No, scalpel no, and be safe, है ना? Which scalpel will you use?
For skin.
So we are doing this resuscitative thoracotomy. Which one? There are two. Which one you are doing? Clamshell.
Anterior-lateral. No.
Oh.
Left side anterior-lateral. I'm going for left side anterior-lateral. Right?
What do you call it? AL? So we'll show you the video. Okay. Okay.
No people reaction, no any what you might know, palpable pulse, but there is PE is there, some style.
So go for incision report.
Any sign.
P
Not
is
also any sign.
a indication for incision report. No. In traumatic cardiac arrest, forget about because heart is empty. So we have Dr. Dinesh Gora from AIMS with us in Trauma 2022, and we just did a recessive thoracotomy simulation on VERVE mannequin. So let's find him. Let's find from him how was his experience regarding simulation and the procedure.
Yeah, it was a great learning session. I think for me also and all the participants who are available, it is very good to learn on mannequins before going on patient, because these cases are very less in number. Better to go for that. Mannequin quality is very good for ED resuscitative that thoracotomy. I thought that like I am doing on real patient while I am doing on this soft tissue and all the things like actively heart is bleeding. So it is mannequin quality is also very
And how was
good.
the instructor?
Instructor, as I know him
Sim educator.
very well before, so he is well trained person and doing die hard for developing.
Who is that person?
Dr. Amar, and he is doing very hard work for to build up our emergency system in India. Thank you.
Thank you.
Sure, sir. Thank you.